Hello and welcome to Public Report. I'm Patty Hutton, your host. Today, our guest is Dr. Ryan Dulde, dentist and member of the Wisconsin Dental Association. Our issue is health, with the topic of the importance of good oral hygiene. Thank you so much for joining us today, Dr. Dulde.
Thanks, Patty.
Please tell our viewers a little bit about yourself and why you chose dentistry as your profession.
Sure. Well, I attended Marquette University for dental school. I've been practicing for about 3 years. And I like dentistry because it's the perfect blend between business and art and science, and you just don't see that very often. I get to run my own business. I get to meet with patients every day and talk about their health. And I actually get to go in and fix something with my hands, when someone has a problem. So it's a really unique profession, and I love it.
Now, the Wisconsin Dental Association has a program about Own Your Own Smile.
Yep, that's right.
Can you share with us what are the goals and the purpose of that campaign?
Sure. So the Own Your Smile campaign is a health literacy campaign that the WDA is putting on over the next 3 years. And it's really focused at teaching Wisconsin adults more about oral health with an emphasis on prevention. We know that preventative dentistry is so important, especially for adults who aren't going to the dentist on a regular basis, because if we can catch things when the problem is small, it's so much easier to fix that, and we can keep people out of a situation of pain or time missed from work.
Can you explain to us a little bit more how important is dental oral health?
Sure. Sometimes we don't connect oral health with the rest of our body health, but really the two can't be separated. All of our nutrition, so much of what impacts our overall health comes through our mouth and our ability to chew our food and get good nutrition. So good health really does start at the mouth. And we're seeing more and more as we look at the research that things like diabetes, heart disease are linked to gum disease as well. So we really try to make patients aware of that, and sometimes people don't know that.
So how important then is it to get your regular x-rays, dental visits?
So as I was saying, preventative health care is just so important. I guess you would say the quote is a dime of prevention is worth $1 of ambulatory care, and that's so true in dentistry too. If we can see people on a 6-month basis, take routine x-rays maybe on a yearly basis, have someone go in and do a professional cleaning and have an examination done, there's a lot of things that we can catch before it becomes a bigger problem where the pain starts to onset.
Is dental insurance often required in order to see a dentist?
Well, I'll tell you that dental benefits certainly help, but they're certainly not required, and that's a misconception. People think that you have to have dental coverage in order to go to a dentist, and it's simply not true. In fact, it might be even more important for people who don't have dental benefits to be coming in regularly for preventative care. And the part of the Own Your Smile campaign that the WDA is putting on over the next 3 years is to help Wisconsin adults recognize that regular preventative dental care is quite affordable, even if you're not using insurance. And we don't want to propagate the idea that dental insurance is a necessity for seeing a dentist.
Now, you mentioned prolonging a visit for dental care. Sometimes could that end up being more expensive if an individual decides to delay because maybe they're uninsured?
Yeah, it definitely can get more expensive. And what I always tell patients is, let's not wait for things to get more extensive and more expensive. And that's just how it works. And unfortunately, we see that time and time again where what started as a small cavity is now being treated with the dreaded root canal and a crown, and even in those cases we sometimes have problems. So the price tag keeps going up, and unfortunately the chance for pain goes up, and the risk for things not working out well goes up. Whenever we can catch something early and treat it preventatively, it just always works out better for the patient in the end.
So how important is it to practice good oral hygiene, and what role would you say an individual has in that personal responsibility?
Yeah, I hate to say it, but not everyone out there is a great brusher, and especially not a great flosser. But the gold standard is to brush twice a day for 2 minutes, to floss daily, to be seeing your dentist, preferably a WDA member dentist, on a 6-month basis. And we just want everyone to establish that dental home so they have someone monitoring their ongoing care. When it comes to home care, Things become a little more challenging, I would say, for older adults. As we lose dexterity, it becomes increasingly harder to navigate around the mouth and get all those nooks and crannies. Other than, simply brushing and flossing using a mouth rinse, the other important parts to home health are, the choices we make, what we put in our mouth. So high sugar, high acid foods, chewing ice, chewing nuts, all those bad habits we all have from time to time, those are all the things that we caution against, because we know that can lead to bigger problems, tooth decay, gum disease, broken teeth, and that sort of thing. And, I love seeing patients on a 6-month basis so that we can have a professional go in and clean the teeth, make sure everything looks great, and they walk out of the office with, sparkling teeth. However, the other, 363 days of the year, we don't get to see those teeth, and we don't get to help them with home care. So really, the ball is in the patient's court for most of the year, and we try to give them good coaching on how to take care of their teeth at home.
Are there any other do's and don'ts? You mentioned kind of the tobacco, sugary snacks, chewing ice that patients should be cautious of?
Well, we talked about the sugar, we talked about the acid, we talked about how we use our teeth. Sometimes we treat teeth like tools, which we don't want to do. Tobacco, you hit on another important point. We have people who use cigarettes, people who use chewing tobacco, and what we see with those chemicals is that not only does it stain the teeth and cause bad breath, but it certainly increases the risk for some really dangerous things like oral cancer. And it really shuts down the body's immune system in the mouth. So your body is trying to protect you from the normal bacteria and the infections that can sometimes crop up. But when you've curbed your ability, to fight those things off with tobacco products, you're already at a disadvantage.
Kind of like you mentioned earlier, people sometimes don't associate their oral health affects the entire body, that they
That's
are
right.
connected.
Yeah, it's the oral systemic connection that people don't always understand.
You mentioned some tips as far as the elderly that may have trouble brushing. Do you have any tips as far as children and parents helping getting their children on a good regimen?
Yeah, sometimes with kids it's a behavioral issue. Kids don't always want to do what has to be done. So I encourage patients to try to make it into a game. I tell patients, give your toothbrush to your kid and let them brush your teeth, and then you take their toothbrush and brush theirs. That kind of brings up a side point that when we share toothbrushes, when we share utensils, people don't realize it, but you can actually spread bacteria and you can spread other conditions from person to person. It's an infectious disease. So keep that in mind. It's better to hand the child your brush and let them brush your teeth for you. And really, it's setting a good example, too, for your kids. The food that shows up on the table in front of your kid is whatever you put there. So making good decisions and showing them what good habits look like so that they can mimic you.
How important would it be for an individual to have a dental home before an emergency would happen?
It's incredibly important. The idea of a dental home with a WDA member dentist is something that we've reinforced over and over. We see some patients on a very infrequent basis, and it's always when things are at their worst. People wait for pain, but they don't realize that the pain doesn't show up until something has become large or extra large in size, or where there's a real problem, irreversible damage that could have been addressed sooner. So the continuity of care that we want to establish with every patient is so important. And if we can have everyone at least identify with some dental office that they call their dental home, I guess you would say, then we know that everyone's got a home base, and if something does come up, a question or concern, at least they have a resource that they can turn to.
And they probably have the patient's records, they know their background.
Right, and they know what the nuances of the case is. What are the disadvantages and the advantage? What cards is that patient holding, and how are they going to help them play that hand?
And when you're in pain, it's not fun trying to figure things out, I'm sure, in a hurry.
No, that's the worst time. It's usually on a Saturday when you're on vacation, and then we get that phone call.
Sure.
So anything we can do to head that situation off is always great.
How important is it to promote a good oral hygiene through continuing education? Can you tell us a little bit about that?
Sure. Like I said, when we do see people on a regular basis, we reinforce those good habits at home for taking care of your teeth and your mouth. As technology develops, as we get more modern in dentistry, we're discovering things every day that we can do to help improve people's oral health. And the difference too here is the change of needs as people get older. What a child needs compared to what a teenager needs is going to be very different from what an older adult needs. And so we have to continue to re-educate people as we go forward, how to take care of their specific conditions and concerns and the things that they're predisposed to. So, having that connection with a regular dentist and seeing that person on a regular basis, it's going to give us an opportunity to have that conversation as the needs of the patient change going forward.
To see how things are working for them, obstacles that they're facing.
Sure, and we try something for 6 months and then we check in, and if we don't see improvement, we know that that's not how the teeth are going to respond well, and it's not effective, and we have to find another solution.
So can you talk to us a little bit about the individuals that may be afraid to go to the dentist?
Oh, sure. We can talk about that. That's a great question. There's a lot of reasons why people feel some anxiety about going to see a dentist. Often it's a bad previous experience, and we've all heard those stories before. Other times it's the anxiety around the finances. People aren't sure what's going to be talked about and what the answer is going to be, and they're a little fearful about that. And then we've got all sorts of other, more irrational fears related to going and seeing the dentist. Dentistry is kind of an invasive thing, and for someone to be treating you in such a personal space, it can be a little bit nerve-wracking for people. The sights, the sounds, the smells, all that bad stuff. So as far as people who maybe aren't seeing a dentist because they're fearful of treatment, it usually does stem from a bad previous visit. And so we take the time to talk to that patient about what's happened in the past, and usually vocalizing it, just getting it out on the table, making sure that the person doing the care understands what happened to that person before is enough to curb a lot of the anxiety and a lot of the fears. Of course, other options are out there. We have a variety of levels of sedation that we can offer patients nowadays. And the great thing about dentistry is that it's becoming more and more painless as we go forward. Modern dentistry is so different from how it used to be, and so those experiences of the past, it takes a while to undo that, but we're giving people good experiences now going forward.
So there's lots of good options for people not to have an excuse to visit their dentist.
That's right.
Thank you so much for joining us today, Dr. Dulde.
You're welcome.
Thank you for joining us today on Public Report. I'm Patty Hutton, your host. Today, our guest has been Dr. Ryan Dulde, dentist and member of the Wisconsin Dental Association. Our issue has been health, with the topic of the importance of good oral hygiene.